My name is Adishi. I'm presenting a topic titled A Comparative Study of Nurses' Perception on Safety and Injury at Work in Delta State, Nigeria. Because of time, what I'm going to talk about now, I'll go straight to the introduction. The awareness of safety and injury at work is an important factor that needs adequate attention in the healthcare delivery system. This generally involves all members of the health team. However, this article is centered mainly on nurses. Now, the purpose and aim of this study is actually to determine the perception of nurses on safety and injury at work in Delta State, Nigeria, and to examine their general attitudes towards injury and safety generally, to make a comparative study on the potential problems of safety hazards, near misses, and at-risk behavior among practicing nurses, to explore the various forms of safety awareness in the hospitals and offer useful recommendations. Now, if you look at the statement of the problem concerning this study, the author discovered from the literature studied that most injuries sustained in the hospitals are almost always attributed to nurses' negligence. Therefore, it is pertinent to ascertain the nurses' awareness level of safety and injury at work, the challenges facing the professional health team members, and the need for the individuals themselves to take ownership of maintaining and sustaining safety culture in and around the hospital motivated the author to embark on this study. Now, if you look at the significance of this particular study, I want us to, because of time, I will go straight to the results and analysis of what I've found out concerning my work. This section describes the presentation, findings, analysis, and interpretation of the study. A comparative study on nurses' perception on safety and injury among professional nurses was gathered among respondents from private, government-owned and mission hospitals in Delta State to make up a total of 100 participants. The data were organized in a mixed statistical package. Objective of this study, I've summarized them before, but in a nutshell, is to determine the various causes of injury at work, to explore the potential dangers of at-risk behaviors during nursing procedures, to understand the safety issues surrounding the use of hazardous substances in the healthcare industry and make useful recommendations, to serve as a guide to the nurse in training who wishes to further research on the subject, and to create adequate awareness among nurses on the importance of safe work practices and procedures through health educational programs. The significance of the study, this article will serve as an eye-opener to the health professionals on the attitudes of nurses towards safety at work in the hospitals. The study will also enlighten the nurses further on the subject and enable them to make the best decisions while performing their duties. The study will also provide a quick reference guide for trained nurses on maintenance of safety throughout their duty periods in the hospital. Next slide, please. The scope and limitations of this study. The study would have been extended to all hospitals in Delta State in order to obtain more accurate data for better comparative studies. However, due to logistic problems and other unforeseen circumstances encountered in the process, the study was limited to a few hospitals, including mission, private hospital, and government-owned hospitals in the 3 senatorial districts of Delta State. Next slide. Now, looking at the literature review, There are so many areas of concern in terms of safety at work, but due to time limits, this article is limited to 3 major areas, and these include work hours, nurses' injury at work, and mental health effects of nursing work. Next slide. If you look at the work hours, you will agree with me that shift work, nurses embark on shift work and long work hours. The relationship between work schedules and health and safety is complex. This is influenced by characteristics of the work schedule, the time of shift, direction and speed of rotation, pattern of days off, shift length, rest breaks, as well as characteristics of the job, the worker, and the work environment. While the focus is on potential negative aspects, some workers experience benefits from shift work and prefer it. That is, people, because of incentive pay, reduced volume of activities, and personnel when compared with day shift. Next slide. Still on shift work, you see, researchers theorize that shift work exerts adverse effects by disturbing circadian rhythms, sleep, and family and social life. Now, disturbances in circadian rhythms may lead to reductions in the length and quality of sleep and may increase fatigue and sleepiness, as well as gastrointestinal, psychological, and cardiovascular symptoms. Long hours may also increase exposure times to workplace hazards. Next slide, please. Risk associated with shift work. Yes, you will agree with me that sleepiness, performance, safety, all these are risks that a nurse will pass through, will experience while at work. Social and familiar disruptions. Long-term effects on vulnerable groups, such as increased risk of colon cancer in nurses working 3 or more nights per month for 15 or more years. Studies have also shown that shift work associated with a modest increase in spontaneous abortion, preterm birth, and reduced fertility in women has been associated with this. Now, exposure to light at work at night, known to reduce melatonin levels, increasing risk for cancer. These are things found from a literature review. Now, looking at nurses' injury at work, you will see musculoskeletal injuries, which is common among the health workers, especially the nurses. Extended schedules and increased workplace, along with increased physical and psychological demands, have been related to musculoskeletal injuries and disorders. Physical or postural risk factors and MSD, that is musculoskeletal disorders. You will also discover that their healthcare work is highly physically or posturally demanding, and tasks requiring heavy lifting, bending and twisting, and other manual handling have been implicated in healthcare worker back injuries. Work schedules and MSD. The work schedule can affect the sleep-wake cycle and working extended hours, such as 12 hours plus, long shifts. That's what I mean by that. Can lead to MSD, musculoskeletal disorders, due to extended exposure to physical or postural risk factors and insufficient recovery time. Next slide. Coping strategies during shift work. A sampling of strategies suggested in the literature for shift work include designing new work schedules and rest breaks during work, altering circadian rhythms with bright light or blue light, optimally timing physical activity or other work demands, improving physical conditioning using caffeine, planning dietary regimens, stress reduction, support groups, and family counseling. Mitigating MSD risks. Use of single approach intervention methods to reduce MSD exposures just like engineering controls, administrative changes, or worker training only, has shown inconsistent outcomes. However, intervention incorporating participatory ergonomics have been found to improve upon previous approaches by allowing for extensive worker input into the design and adoption of preventive practices. Next slide. Next slide, please. Hello. Intervention for this. We are still on intervention for MSD. 3 common interventions used to prevent work-related musculoskeletal injuries associated with patient handling are as follows. Classes in body mechanics, training in safe lifting techniques, back belts, despite their widespread use. These strategies are based on tradition rather than scientific evidence. There is in fact strong evidence these strategies are not effective. Recently, there has been a major paradigm shift away from these approaches, towards the following evidence-based practices, and these include patient handling equipment or devices, no lift policies, training on proper use of patient handling equipment, devices, and patient lift teams. Common injuries and safety at work. You can agree with me that there are needle stick injuries, occupational exposures, volatile organic compounds, sterilants, medications, pesticides, latex exposures. All these are common injuries and safety at work. Now, mental health effects of nursing work. Working in nursing increases the risk of experiencing both minor and major psychiatric, with job strain contributing to this outcome. Minor psychiatric morbidities include feelings of tension, anger, anxiety, depressed mood, mental fatigue, and sleep disturbance. Major mental disorders such as major depression, anxiety disorders, and psychotic disorders are less common, but they are possibly experienced in this process. But they can be induced. Okay. Interventions to reduce mental changes. Interventions to reduce work-related mental changes have focused on either changing the organization of work to reduce the stressors, or changing the worker's ability to cope with stress by providing cognitive behavioral interventions, relaxation techniques of various types, or multimodal strategies. Next slide. Results and data analysis. This session describes the presentation, findings, analysis, and interpretations of the study. A comparative study on nurses' perception on safety and injury among professional nurses was gathered among respondents from private, government-owned, and mission hospitals in Delta State of Nigeria to make up a total of 100 participants. The data were organized as you can see on the screen. Next slide, please. Now, these are the results, the presentations that are found. But go to the next slide so we can make a little interpretation of this. Still go to the next slide. Yes, that is the demographic data. From the table above, table 1 above, the demographic data represents the study population, stating their age brackets and comparative analysis of the various participants across the private, government-owned, and mission hospitals in the state. Only 8% of nurses within the 20 to 25 years age group participated in the research. 26 to 30 years age group that took part in this exercise formed 20% of the population. 29% of 31 to 40 year age bracket participated. 41 to 50 years age group constitute 22% of the sample population. 51 years and above made up 21% of the sample population. A total of 100 nurses participated in this exercise as stated above. Next slide. Go to the next slide. Go to the next slide. Okay, no, go to the next. Next one, next one. Next one, please. Next one. Okay. The common, no, come back. Okay, common safety hazards nurses and the patients are exposed to at work. From table 2 above, 59% of the sample population saw slippery walking surfaces as safety hazards in the workplace. 56% believed nursing unconscious and elderly patients on a high bed without side raise as unsafe as well. Now, the least common safety hazard identified was exposure to flammable liquids with 32%. Next slide. Next one. Next one. Now, behaviors come back. Behaviors associated with injury or illness in the workplace. That is from the table 3 above. Recapping injection needles after use was most identified as an unsafe act among practicing nurses. That is 60%, which commonly exposes nurses to the risk of injury at work and subsequent disease transmission. It is also sad to note that majority of these incidents were not reported appropriately for fear of being punished, whereas reporting it would have helped to prevent potential spread of any implicating blood-borne diseases. Giving medications without following the 7 rights was also identified as an unsafe act, scoring 45% of the total sample population. Assuming an awkward posture during nursing work was also found as the second leading unsafe act among nurses at work, bringing about musculoskeletal disorders. Next slide, please. Next one. Okay, to the next. The next one, please. Okay, yeah. This is to tell you the... No, come. Okay, injuries or illnesses usually encountered by the nurses at work. That is the table number 4. What is... I'm going to interpret briefly what those figures represent. Using the analysis of injuries or illnesses usually encountered by the nurse while or after performing her duty. Number 1, an allergic reaction and repetitive stress injury are both identified as most prevailing injuries encountered by nurses in the course of delivering their duties in the hospitals, with both scoring 53% each among other injuries sustained by the nurses. From the overall rating, however, injuries are most sustained by the nurses in the government-owned hospitals with a score of 43.5%, followed by the private hospitals maintaining her second position with a score of 31.7%, while the mission hospitals scored 24.8%. Next slide. Next slide, please.
So Monday.
Okay, please, can we go straight to the summary, so that we can get what we are talking about because of time. Let's go to the summary, please.
Last page, huh?
Hello?
You want to go for the last page?
The summary.
Yeah, first or last. Yeah, summary.
You are there.
Okay, this is summary. Quick, fast. Time is up.
Okay. Huh? Okay, summary.
Continue.
Slippery walking surfaces are most frequently identified as the leading safety hazard in the various hospitals, followed by nursing unconscious and or elderly patients on high beds without side raise as the second leading safety hazard to the patients. Among the various hospitals under review, 40% of safety hazards were most identified in government-owned hospitals, taking the lead. Next one, next slide, please. Next slide. Hello? Hello, next slide. Next slide, please. Hello? Hello?
Hello?
Okay. Okay. Tapping injection needles after use was most identified as an unsafe act common among practicing nurses, which commonly exposes nurses to the risk of injury at work and subsequent disease transmission. It is also, that is the major thing that we need to understand. Awkward posture during nursing care was also found as the second leading unsafe act among nurses at work. And from the comparative studies, unsafe acts are most common in general hospitals with 43%, followed by private hospitals. Next slide, next slide. From table 4, you can discover that allergic reactions and repetitive stress injuries are both identified as most prevailing injuries encountered by nurses, with both scoring 53% each among the other injuries sustained by the nurses. From the overall rating, however, injuries are most sustained by the nurses in the government-owned hospitals with a score of 43.5%, followed by the private hospitals, and then the list with mission hospitals, 24.8%. Next slide. From table 5, much emphasis is being laid on refusing to take shortcuts with a score of 68%, which has been identified to have had the potential to cut life short. From the overall rating too, the government-owned hospitals are also doing much more to manage these incidents by 34.9%. This is a reactive rather than proactive measure. Next slide, please. From table 6 above, you see that the greatest challenge identified by the respondent is too much workload and little or no time to rest. And from the overall rating, mission hospitals have the greatest challenges of managing and coping with injuries and illness at work. Next slide. Now, much emphasis is also placed on adequate supply of the right materials for use and staff training to be instituted as soon as possible. From the overall rating, the mission hospitals are also on the downward trend in terms of meeting up with the ways to overcome the challenges facing them. Next slide, please. Professional nurses are obviously aware of the ways to prevent or mitigate injuries and illnesses at work. The major problem is their inability to deliberately take the decision to always follow all the tenets of operational excellence in all they do, so as to do them in the right way all the time. Nurses should make themselves available for training. Next slide. Summary of findings. In Delta State, 98% of nurses run shift in the hospital, out of which 60% admitted having had one form of health problems or the other with shift work and long work hours. Only 2% of nurses do straight morning duty. Most nurses in the hospital sustain injuries due to slip and fall incidents, with the smooth tiles used on the floors and walkways. Many nurses still take shortcuts to perform their duties and compromise safety at the end
Hello,
of the
Adishi
day.
Monday. Hello, Monday.
Of needed material.
Monday,
Yes,
your time is over.
hello, ma'am.
Please conclude. Yes, please conclude your presentation. Okay. Please tell me the
I should
conclusion.
continue?
Yes,
Okay,
yes,
conclusion.
conclude.
Yeah. My recommendation now is, can I start with the first part of the recommendation?
Start.
Okay.
Your time is over. Please conclude your presentation.
Okay, hospitals should be devoid of slippery materials on the walkways and floors. The professional nurses also need to follow all the tenets of operational excellence as follows. Always operate within design and environmental limits. Always operate in a safe and controlled condition. Always ensure safety devices are in place and functioning. Yes. Next slide to conclude. Always follow safe work practices and procedures. Always meet or exceed customers' requirements. Always maintain integrity of dedicated systems. Always comply with all applicable rules and regulations. Always address abnormal conditions. Always follow written procedures for high risk and unusual situations. Always involve the right people in decisions that affect procedures and equipment.